So diabetes. What is diabetes? Diabetes is a disease that affects the production of insulin, which in turn affects the cell's ability to get glucose. So glucose is needed for the cells to do cellular respiration, which produces ATP, which allows the body to function / move. And then insulin is a hormone that needs to attach to insulin receptors, which then allows glucose to enter the cell through glucose channels. So that's how glucose gets into the cell and then makes ATP. And then when there's little insulin or the insulin doesn't work anymore, then the body cannot function properly. So there are two different types of diabetes. Diabetes 1 is a genetic disease, which is when the pancreas produces no insulin. A mutation on chromosome 6 is related to people having diabetes 1. Diabetes 2 is a disease that occurs because of lifestyle, and there's some genetic disposition to it. In diabetes 2, the pancreas makes insulin, but the tissues don't respond to it. The pancreas makes insulin, but the cells don't move their insulin receptors to the membrane in response, so the cells are insulin resistant. So this is like a type 1 diabetes pedigree. And as you can tell, the people that have diabetes have a mutation present. And the mutation in how you get diabetes is like through mutations on like multiple genes. And then with diabetes 2, it's like you have genetic disposition to it because of your race and if a family member that is genetically related to you has had it. So what are the negative impacts diabetes has on the body? So it causes damage to large and small blood vessels. Having weakened blood vessels makes the person more at risk to have a stroke or heart attack. And then eye issues because the veins and arteries in your eyes have a lot of pressure in them, causing there to be issues. High blood pressure and cholesterol are also another common effect of diabetes. There's also bladder and kidney issues as the urine and the stool are not processing the way they should, as there's a lot of glucose left in the bloodstream. So this is, you can kind of tell a healthy eye versus a diabetic eye. And you can see like the vessels are kind of inflamed and there's a good amount of things wrong with it. So these are also some more of the symptoms of having ketosis, which can happen if you have diabetes. There's also diabetic shock when there's not enough glucose in the cells, so then you go into diabetic shock, which can be bad for you and cause convulsions, jerky movements, and clumsiness, in addition to confusion and anxiety. And then this one just shows the effects that diabetes has on each major part of it affects. So who is most at risk for developing diabetes 2? So people that are obese, lack exercise, have genetic disposition, and have hypertension. So for example, people that are obese normally have more adipose cells, which release adipokines, which are signaling molecules to cause inflammation, and inflammation is related to insulin resistance. In addition, studies show that if there is a twin that has diabetes, the other twin is more likely to have diabetes. And then how do lifestyle choices affect the onset and impact of diabetes? So like, if you aren't eating healthy, then you are more at risk for developing diabetes 2, because you have more adipose cells, which previously mentioned cause inflammation and inflammation is related to having diabetes too. And then exercise and physical activity, if you don't have that much of them, then you're also more likely to have diabetes. And then the CDC said weight loss of 5 to 7% of body weight achieved by reducing calories and increasing physical activity to at least 150 minutes per day resulted in a 58% lower incident of diabetes 2. And then this is also a diabetes 2 prevention the CDC has. And then this is my works cited.